Good afternoon, everyone. I'm Dr. Laura Eierman, a very proud graduate of the Cornell University College of Veterinary Medicine and a board-certified veterinary nutritionist with Nestle Purina, as well as the clinical nutritionist at the Oradell Animal Hospital. And it is my absolute pleasure to welcome you to today's webinar on the role of nutrition for your pet's wellness, health, and longevity. And I cannot think of a topic more near and dear to my heart than food and pets. And it's my sheer delight to welcome my colleagues, Dr. Loftus and Dr. Venator, who'll be joining us. But before we get started, just a couple of tips for our audience. First, you'll notice in the chat box, Karen has posted our agenda for today for the next hour. In addition, if you have any technical issues, you can send a private message to Mr. Eric Holmberg, who will help you with your AV needs. In addition, there's a live transcript for today's session. You can click on that button and view the transcription. We're also going to be asking the audience to submit questions. Please use the Q&A box to submit your questions. And I want to thank everyone who submitted questions when you registered, because we've already got a fantastic list of questions. Today, we're going to start with me introducing my colleagues and friends, starting with Dr. John Loftus, also a fellow Cornell graduate from the College of Veterinary Medicine. Aside from that, he's actually a double doctor. He has a PhD as well. He also completed a residency in both internal medicine and nutrition at Cornell. He now serves as assistant professor in clinical sciences at the Veterinary College. Our second panelist and dear friend is Dr. Kurt Venator, also a double doctor, PhD, and DVM from the college, and currently serves as the chief veterinary officer for Nestle Purina. So we're going to start our session today hearing a bit about Dr. John Loftus's research and work at Cornell. So with that, John, I'd like to pass the baton over to you.
Thank you, Laura. Okay, so I wanted to go over really broadly the kind of research that I'm doing in my lab, and then kind of hone in on some of the more nutritionally related projects that we have going on or that we've already completed. Next slide, please. So if you go to my lab website, and it is loftuslab.vet.cornell.edu, or you can just Google Loftus Lab Cornell, you'll find this is the homepage, and it gives kind of a broad overview of the research projects that we're working on right now. So there are kind of four main ones that I wanted to highlight. So the first one is canine longevity project, and I'll talk a little bit more about this next. There isn't much nutrition actually to this project, and I'll explain that. But the other projects that I work on, which have more nutrition embedded in them, is one, my interest in immune-mediated disease. So as Dr. Eierman mentioned, I'm a double doctor with a PhD as well. And my PhD was in immunology. I actually studied a horse disease years ago. So one of my main interest is immunology and immune-mediated disease and autoimmunity. And the link to nutrition there is my lab's really interested in the role vitamin D plays. And I'll talk more about that to come. There's also a disease called hepatocutaneous syndrome we study, and this disease requires high protein diets and amino acid infusions and things like that that are really nutritionally relevant. And then another project that we've worked on and are working on now is feline hyperthyroidism, and I've previously worked with one of the diet for treating that disease. Next slide, please. So I want to tell you a little bit about our aging study first, and I think it certainly does have relevance to nutrition in a broader concept. That nutrition for aging dogs is really important, and something we'll probably talk about more during the panel discussion and hearing your questions. So this study is funded by the VICA Foundation, and essentially what we're interested in is studying aging from the standpoint that our genes have a lot of these basically genes that come from viruses. And as we age, it seems like those genes are turned on. And so a lot of the changes that happen with aging, we think might be related to this. So what we're doing essentially is treating these dogs with an antiviral drug and seeing if that reduces their incidence of cancer, other problems that come along with aging, and even potentially extends their lifespan. So I mentioned there isn't really a nutritional angle to this because they're all on the same diet, with a few exceptions that need special diets, because we didn't want that to be a variable. So next slide, please. So we're studying this aging phenomenon in a group of sled dogs, retired sled dogs. So next slide, please. So we have about 90 sled dogs. Oh, sorry, go back. So this is just a small example of the dogs that we have in their pictures. And if you go to the VICA website, we have pictures of all of the dogs, and you can learn more about them. They all have interesting stories or interesting personalities that we describe. And some of them are even Iditarod winners. The reason we chose sled dogs is because they're a breed, but there's a lot of diversity in this breed. They're Alaskan sled dogs. And they all retire around 8 years of age, which was the age 8 years and up that we wanted to study. So next slide, please. So we obtained about 100, a little over 100 sled dogs initially from all over the country, a couple from Canada, and this is just an example of where they've all come from. Next slide, please. So I mentioned that my lab, or in collaboration with others at the college, are interested in a lot of nutritionally related science. And so these are some of the studies that I've worked on now or in the past. So I mentioned vitamin D, and what we're interested in particular is how vitamin D impacts the immune system of dogs in various diseases, particularly autoimmune types of disease. And this is a bit of a timely topic. Many of you have probably heard about the role of vitamin D potentially in COVID. And part of that, at least, is almost certainly due to the effects it has on the immune system. And I can talk more about that later. Hepatocutaneous syndrome I mentioned before. This is a pretty rare disease, but basically it affects their skin and liver and metabolism. And this is a picture of Maggie May, one of my patients with the disease that we first saw in 2015. I'll point out now the average lifespan for most of these dogs previously was about 6 months. So as you'll soon see, she's really beaten the odds with this disease. And then we have some collaborative projects with other faculty, for example, evaluating therapeutic diets in gut disease. We've also, in the past, I mentioned hyperthyroidism. So we do have an ongoing study that's indirectly related to nutrition, but we previously did a small case series in cats that we treated with iodine-restricted diet. And those cats had more severe hyperthyroidism. We've done a pilot study of a kidney diet for dogs, evaluated minerals in dog food, and then published on energy requirements in sled dogs. All right, next slide, please. So with that broad overview, I just wanted to show you Maggie May today. So she was actually in this year's calendar. She's done just amazingly well, and has had some other medical issues other than hepatocutaneous. So she's seen almost every service in the hospital, which is part of the reason she's in the calendar. And you can see she absolutely loves Cornell and likes to dress up too. So with that, we wanted to jump into a panel discussion that Dr. Eierman will lead.
Thank you, John. You do such interesting and incredible work, and thank you for sharing Maggie May with us. That is a horrific disease, and I've been in practice for quite some time, and just the advances that we've made over the years, especially in nutrition, to help these patients is phenomenal. So thank you for the work that you do with those patients. I want to focus, knowing both of you have quite a bit of knowledge regarding immunology and the role of nutrition. I want to explore that a bit more with you, especially because, John, you mentioned that it's quite timely. And of course, as veterinarians, we always are very proud that we can treat all species. And we're also very proud of our role in the concept of One Health, how we not only focus on animals, but the implication for human health. And I'm going to really call on Kurt in a little bit to try to explain to us how that works in both directions, how what we know about human nutrition applies to pet and vice versa. But I do want to hone in a little bit more on vitamin D because it is so timely. John, as you mentioned, and many people in the audience may realize that as we're all thinking about the immune system, not just for autoimmune disease, but infectious disease.
Right.
And of course, COVID comes to top of mind. We're learning in human medicine that there does appear to be an association between vitamin D status and outcome in humans with COVID. And I'm actually thrilled that I just realized that my mom's physician is measuring her vitamin D level and checking her status. Most of us think of vitamin D as the sunshine vitamin because as humans, we can obtain D from the sun. Well, dogs and cats can't. That's the fun thing about nutrition. We learn all of that metabolism they cannot. I think most of us think about vitamin D in terms of skeletal health.
Mm-hmm.
The fact that my calcium supplement contains vitamin D because it helps my intestine absorb that calcium. So John, I'm going to start with you and ask you to maybe dig a little bit deeper into the connection between vitamin D and the immune system. How does that work? And what should we be thinking about with our pets? Because they can't get it from the sun. So where do they get their vitamin D?
Perfect. Yeah, no, that's obviously an area near and dear to my heart. So you mentioned dogs can't get vitamin D from the sun. And I think one of the misconceptions I'll start with is that it's because they have fur. And it's not. As you alluded to, it's because of metabolism. So folks out there that want their dogs to have more vitamin D, don't shave them. That's not going to help. They need it from their diet. So what we're finding, and there's a lot of data in mouse and people and cell culture, and we're getting more information in dogs specifically and cats about the role vitamin D plays in the immune system. And essentially, vitamin D there's a couple of aspects. One is that vitamin D, we think about vitamin D in the diet, but the form of vitamin D that actually does most of the work in the body has to be converted. So we take vitamin D in through the diet if you're a dog, or we get some from sunshine in people. Although it's also, that's important because here in Ithaca, we're not getting much vitamin D. So you do need it in the diet for many people as well. So you take in vitamin D, and your body, your liver first, and then your kidney has to make some conversions to make what's called calcitriol, the active form of vitamin D. And but as it turns out, so the kidney is really kind of the site that we think about for bone health. It makes calcitriol for bone health. It turns out, though, that the enzyme that is needed to make calcitriol, immune cells also, some immune cells will also produce that enzyme, and some other enzymes in the steps to make active vitamin D. So, so immune cells can actually kind of turn on vitamin D in their little immune environments, right? So you got, a bunch of immune cells in one spot, and they're all talking to each other and figuring out how to fight a disease. They can make more vitamin D, and then that vitamin D is recognized by other immune cells. So they have the receptors for vitamin D. And what that does, and it depends on what kind of immune cell you are, but essentially what that does is it tells the immune cells and it helps them kind of adjust their immune response. And what happens with the immune system is the perfect thing that happens with the immune system is when it sees a pathogen or a germ that shouldn't be there, and it says, we're going to get rid of this. So it could be a virus or bacteria, and it doesn't really hurt us, right? But the immune system, as we've all heard about autoimmune disease, has the potential to shift in the wrong direction, or sometimes just hurt, our own cells in its efforts to fight infections. So what vitamin D often does is it kind of shifts those balances to drive the immune system towards killing the bad guys and minimizing harm to self. And it does that through a variety of ways. But it's sort of, the balancing system, and it really shifts that balance to reduce autoimmunity, improves it turns on some of the proteins that will act against viruses, for example, or bacteria. So it's really kind of a guiding kind of phenomenon. In dogs, so the research that I published, and we have ongoing research extending from this, is that we found that dogs with essentially autoimmune disease do have lower levels of vitamin D than healthy dogs. And then the dogs with autoimmune disease that had lower vitamin D, in kind of the lower half of the measurements for that group, they had shorter survivals. They didn't survive as long. And so there's definitely a link between low vitamin D and poorer outcomes in dogs at this point, and not just the case for autoimmune disease. So we're really trying to explore now a little bit more detail there, get into some of the mechanisms as to why do those patients have lower vitamin D, because as we mentioned, dogs get their vitamin D from their diet, and most of these dogs were all on similar commercial diets, so they should have plenty of vitamin D in their diet. So it's probably something that's going on with their vitamin D metabolism that's changing that. So those are areas that we're exploring more.
So if vitamin D is important, should our audience run out and give if a little is good, it's a lot better? Can you address that? Should we all run out and get vitamin D?
Great question. So I think in people, they have pretty good guidelines as to what you would supplement for a person with multiple sclerosis, for instance. We aren't at that point with dogs. We can make, some reasonable guesses about a dose that we could use that's safe, and you could do that with a veterinarian. I wouldn't do it yourself. And the reason for that is vitamin D is called a fat-soluble vitamin. And one of the problems with most of the fat-soluble vitamins is that they are stored. And if you store too much of them, they can become toxic. So it's kind of a Goldilocks thing where you want just the right amount of vitamin D. So I wouldn't go out and start supplementing your dog with vitamin D without the guidance of a veterinarian.
Thank you. Sticking with the topic of immunity and the immune system, Kurt, I know you have some knowledge about other nutrients, ingredients, dietary supplements that can be good for our pet, and some of it borrowed from human nutrition, health in terms of immunity. So I was wondering if you could share some of that with us.
Yeah, certainly. And John, thanks for the presentation. I love the research. I think this, the concept of nutrition and immunology, even the field of nutritional immunology that's evolving, I would say over the last decade or two, I think really speaks to the concept of One Health, right? And that it links up what can we, and when a lot of people say, well, what is One Health? We'll just keep it really basic. It's what can we learn from human medicine, right, to apply to veterinary medicine, and as well, what can we learn from veterinary medicine, John, like your research with VICA, that we can apply then back to human medicine. And to your point, immunology is so important to overall health. And I would put forth nutrition, is very much linked to that, right? We know that nutrition is a cornerstone of overall health and well-being, right? If we go all the way back, Laura, to Hippocrates, right? We will hear, let food be thy medicine and medicine be thy food. And now it's exciting because as you have this research going on in immunology, how can you bolster these immune cells? How can you bolster the immune response? We're finding out that there are linkages, not surprisingly, with what goes on in terms of what's going on in your gut and how you're feeding that particular pet. One of the main reasons that some people may be aware of is because the majority of our immune system is actually located in humans and in pets in the gut. And when you think about that, what we call the GALT, the gut-associated lymphoid tissue, and all the immune cells that are going on in that gut, we recognize that what you do in the gut has an overall effect on the health and well-being of pets. And so, I'll give you a specific example, one that I think, again, speaks to One Health, the power of research, as well as the power of changing lives. And that would be the area of probiotics. I think a lot of folks today probably have heard about the benefits of probiotics to human health. Maybe your doctor's spoken to you about that. Well, probiotics are very powerful even in veterinary medicine. And the example I'll give you is a probiotic that we developed commercially. And this really speaks to the whole concept of how much research and development goes into innovation in the pet space. So out of 10 years of research on the human side, we then brought that research over from our parent company, Nestle, to Purina. And what we looked at is how could we use a probiotic, so a live bacteria, how could we provide it to cats and dogs to alter their microflora, so essentially the bugs that live in the gut, that balance, same thing you're doing if you're taking probiotics as a human per your doctor's recommendation. And what we found is that by balancing that microflora, so you have more good bacteria and less bad bacteria, you can have a significant impact on the overall health and well-being of dogs and cats. We can use it certainly clinically prescribed by a veterinarian for managing diarrhea and vomiting, but we also found a tremendous amount of research that by balancing that gut microflora, the bugs in that gut, you can actually really bolster the immune response, thereby really setting the stage for promoting overall health and well-being.
Yeah, no, thanks, Kurt. I think to echo that, there are so many components. You touched on one really important one, but I mean, just thinking from just protein and fat in the diet, I mean, the importance of that to the immune system is just incredible. I mean, you can't have an immune system if you have protein deficiencies, fat deficiencies, the role of omega-3 fatty acids in helping to modulate the immune system and kind of even it out and reduce inflammation. I mean, the list just goes on and on.
It does. And even if we think about part of the immune system that we're familiar with, antibody that we use to fight things, it's a protein. So we need those building blocks, those amino acids to make those. And everything in medicine is a balance, as you're mentioning. I mean, too much inflammation and response leads to autoimmune, leads to some chronic disease conditions. And the fact that we can influence that with diet is just amazing. The fact that we can choose certain types of fatty acids that may limit inflammation, maybe a little less inflammatory is just amazing. I'm going to hit a quick question in Q&A because it's a one-off fast. I saw two people asked about, can my pet's vitamin D level be measured, since I mentioned my mom's was being measured? And the answer is yes. It's not going to be part of the routine blood count chemistry that your veterinarian would be doing as part of a wellness exam, but there may be certain conditions when your veterinarian may order that test. So for example, at our practice, we recently had a kitten that was being fed a homemade diet that was exclusively chicken breast and a little bit of some carbohydrate in it. Chicken breast is not a good source of vitamin D, and unfortunately, nor calcium. And unfortunately, that little kitty came in with some fractures. And we already kind of knew from our diet history that that little critter was going to be deficient in vitamin D, but we can document that if we need to. And we'll get a bit more into that with questions probably, because I see a lot popping up about diet and pet food selection. But before I get into that, only because this ties in a bit with John's research, also some research that I know Kurt is very familiar with. And also coming from a lot of the questions that were submitted when our audience registered. And this is around the area of healthy aging, longevity, and wellness. So, John, I know a lot of your work is using a lot of your internal medicine expertise, but as a nutritionist, can you put that lens on and share with the audience who may have pets that are getting a little bit older, what recommendations and guidelines you have for them?
Oh, it's a great question, and I think I'll start and probably come full circle as just by saying, I think particularly for your senior pets, customizing is really important. So working with your vet to find what's right for your senior dog, because as they age, they get we all get more and more disease, and we all get different diseases, right? So those conditions are going to be unique to your pet, and really so many of them are modified or made better by diet. Some of the general things that I think of, one is protein. And I think one of the, and I think this misconception is shifting away from a misconception, is that there was the idea that, oh, you want to cut back on protein as dogs age because it can lead to kidney disease. And what we're finding is that that's absolutely not true. Certainly, if your pet is developing kidney disease, then you might want to, you probably want to put them on a renal diet with, your veterinarian, and that's going to be lower in protein, but more importantly, lower in phosphorus. So protein for the general aging dog is really important. And, I would look to some of the, Purina, since you're both with Purina, has good senior dog diets. And then the other diet that I think is emerging is really important for a lot of older dogs is Bright Mind. There is Hills BD. And these are diets that address cognitive dysfunction in dogs, or doggy dementia, as it's often called. And those, there are, various things in the diet, of course, that are helping reduce some of those signs of cognitive aging. So, dogs as they get older can sometimes start to, become confused or have, different behavior. Sleep cycles are altered. And so these diets really can help with that. So Bright Mind, Purina, BD from Hills are a couple of examples. There's also NeuroCare, which is the prescription from Purina. But I think, those are the kind of over-the-counter diets that I think of. A good senior diet that hasn't gone the route of reducing protein. Look for a senior diet that's gone the route of maintaining or even bumping up protein compared to what your dog was getting as a middle-aged dog. And I think those are the main areas that I think of generally. A few nutrients of import omega-3 fatty acids, I think thinking about those are really important. Other antioxidants may be important, and they are present in, a lot of those diets. But again, customizing, because your dog might be, I think I saw something pop in the chat, and I just saw diabetic. And so, if your dog has diabetes, they're going to need a little bit more customization. Again, if they have renal disease, that's probably more important than thinking of a general geriatric dog diet.
Thank you. And I saw we had a question about kidney disease, so that was incredibly helpful. And, as a clinical nutritionist who spends a lot of time in the exam room, speaking with clients, that tailor and individualization is very, very important, especially with seniors. We have good, guidelines of what we call life stage nutrition. We know that puppies and kittens need more calcium and phosphorus because their bones are growing than an adult. They need more protein because they're building muscle and tissue. So we have some guidelines that I refer to as the puppy or kitten RDAs, like we use in our nutrition world. And we know that for adults. Well, when we start getting into senior nutrition, we're getting a bit into humans as well, right? Some of us are fortunate, robust 80-year-olds that are hiking and active, and some of us have some health conditions as we reach middle age. So not one diet fits all. And I think that's a really good take-home message. And I say to my clients, nobody knows your pet better than you do and your family, followed by your family veterinarian, your primary health care provider for your pet. So talk to your vet, ask your veterinarian what is right for your pet in your household. And then if it gets complicated, we have internal medicine specialists like John, we have nutritionists like John and myself. But carrying along that line, because particularly, John, you mentioned some fatty acids relative to aging, both the omega-3s for osteoarthritis, and then the medium chain triglycerides related to brain health. And I'm going to ask Kurt if he can give us a little perspective. Kurt is in an interesting role where I may be in the exam room with one pet and one person for that individual. Kurt has a broader kind of, population health mindset where he's involved about thinking about the aging population of dogs in general. So Kurt, if you wouldn't mind, tell us a little bit about how this idea of a certain type of fat, a medium chain triglyceride, gets from the minds of some smart researchers into something that I can, feed my own senior dog.
Sure, that's a great question, and I may even, if it's okay with you, just even go a little bit higher level up, go up to 20,000 feet with a theme here, because I think the theme, John, that you brought to life, and Laura, your comments have brought to life, is that you can do a tremendous amount through nutrition. And in order to do that, it really has to focus on research and development. It has to focus on underlying science. And there's a tremendous amount of work being done each day, both in the private sector as well as in the academic sector, and oftentimes both together, right? We partner extensively with institutions like Cornell, and we love those partnerships because it really fuels our knowledge. And that's where it really, I would say, starts, Laura, is with understanding new science and how that has an effect on how we formulate products. John did a great job talking about, for years in the 70s and the 80s, it was about protein restriction when it came to older dogs. Then new science came out in the late 90s and the early 2000s showing that actually, older dogs and older cats actually need more protein to maintain that lean body mass. And so what I find so exciting is many people think it's just kibble sitting in a bowl, right? But in reality, there's a tremendous amount of science and innovation and partnership between the private and public sector to help advance and support the claims that you're seeing on package. So that's kind of the bigger theme I just wanted to touch on. And now let's give the example through MCTs. And so, MCTs are medium chain triglycerides. Many folks that are on the call today may have read about it out in the marketplace, maybe talked to a human nutritionist or their doctor about the potential benefits. Again, speaking to this One Health initiative. So where did it come from? Well, the reality is all of us, I mean, the reason we're so passionate as veterinarians, either in industry or in academia, is we want to help pets live longer. We also want to help pets live better as they live longer. And so to John's point, what we realized is when you get to aging dogs, at times we can see changes in their behavior. And sometimes it's very subtle, sometimes it's more pronounced. Sometimes they're just less active, right? Sometimes they may just be less alert. They may not want to go up the stairs. Then it can go to maybe they're just staring in a corner, looking at the wall. And so what that speaks to is what you mentioned, cognitive dysfunction or cognitive decline. And so the question is, well, how can we potentially improve that through nutrition? And so our team of researchers started really diving into this. And what they found is that around age 7, the metabolism of the nerve cells in the brain changes. And essentially around age 7 and above, these cells become less efficient at using the energy source glucose, which is essentially sugar. And glucose is what really turns on these nerve cells and allows them to talk to each other. So if they're not as efficient, maybe they're not talking as well to each other, resulting in the signs that owners are seeing at home. So then the question is, okay, well, how can we work internally with our researchers, maybe in collaboration, in this case, yes, with external people, to put the best minds together to say, well, could you come up with an alternative energy substrate that you could put in the food, medium chain triglycerides, that then get converted through metabolism to ketones. The ketones cross the blood-brain barrier, and ketones act as an alternative energy source to essentially fire up these neurons again. And one of the things I want to bring out here is, again, I'm talking a lot about One Health, looking at what's going on in human medicine, going back to vet medicine. The other thing is that the level of science that goes behind this. I mean, to me, the gold standard that all of us look to is that it's going to be published in a peer-reviewed journal article. And obviously this research was in collaboration with academic partners. And that's kind of the gold standard. So not only do you have then, what the claims that are on a bag, you have the science behind it published, peer reviewed. And then now, we're thrilled because the testimonials that are coming out from this product are remarkable. I mean, you have owners, almost crying at times on TV because, quote unquote, their dogs are back to being, their old, younger dog in terms of their activity level. And so for me, I love this example, Laura, because it speaks to so many of the themes today. But the ultimate one is, how can we help our pets live longer and better throughout that time frame, all through, remarkably, nutrition alone, which is, to me, is pretty exciting and pretty powerful.
Anything else we can use MCTs for?
Well, you can, the other thing that John certainly mentioned was even beyond this particular diet, that's an over-the-counter diet for, cognitive decline and dysfunction. We did an extensive amount of research in the area of neurology, looking at epilepsy in dogs. And what we found in working with a leading global neurologist is that, combining that with some other nutrients, along with adjunct veterinary therapy, so it could be pharmaceuticals, and the challenge, if you ever had a dog with epilepsy, is it's often idiopathic, which means we don't know the underlying cause. We often put them on medications. They can often be refractory over time, and there are side effects. So again, our thought was looking at human medicine and then taking it over in veterinary medicine. If you can use MCTs and other nutrient blends to actually help reduce the frequency and the severity of seizures. And that's exactly what this therapeutic diet that veterinarians can prescribe does. And for me, again, when it comes to nutrition, this is one more tool in the toolbox of veterinarians in the exam room that they can use to help manage pet health conditions.
Thank you. Such good information. Boy, I think we could panel discuss all day, but I do want to make sure we have time for questions because there have been some great questions that were coming in, and you set that up well. We actually had some people asking about epilepsy as one example, and senior diets, as John mentioned, not just MCTs but antioxidants play a role. So again, a lot of this I keep, going back to saying, have these discussions. I was a general practitioner for about 10 years or so before I decided to specialize in nutrition. And I know that in your basic wellness exam, or you're in there for an ear infection or something else, sometimes we're not focusing on nutrition and thinking about it, but both pet parent and veterinarian. But, my bias now is all pets eat, and all pets can eat well. And part of our discussion, especially, I would be remiss to participate in a panel that talks about longevity without mentioning it's not just what you eat, but how much you eat. So I'll make that plug as a veterinarian that there is one thing, and one thing for sure, that we know leads to a longer life and a better quality of life. And that's feeding to a lean body condition. And I've had friends tell me, and I think this is really good advice, if your neighbors and family aren't telling you, boy, your dog or cat's kind of skinny, they're probably not lean. So I use that. I use that mantra and think about that when I'm, out with my dog and people go, he's kind of thin. And I say, thank you. It's hard work to have a retriever who's thin. So keep your pets thin. But that's going to segue a little bit now into, if I were to look at the questions that are coming in now, as well as those that were submitted ahead, I would say there's a big overarching question around what should I feed my dog, would be the easiest way to put it. And we'll delve a little bit deeper, because some of our questions came to being, should I cook for my pet? Should I feed a commercial diet? If commercial, how do I pick the right one? Should it be kibble? Should it be canned? Should it be fresh? I'm going to just set the stage again as somebody that does a lot of clinical work, and often the way that I explain nutrition for dogs and cats to my clients is to say, it's not exactly how human adults currently eat. It's actually more like the way human infants eat. And if we think about that, an infant sustains themselves on breast milk or infant formula. And that ideal food, if that infant consumes enough to meet their calorie or energy needs, that formulation provides and delivers all essential nutrients. It's complete. And those nutrients are in the right amount and ratio. They're balanced. So I saw a question pop up about, puppies, kittens, when do they go to an adult diet? Well, because that balance of calcium and phosphorus is so important for bone health, the answer is until skeletal maturity. So for a giant or large breed dog, that takes longer. That takes over a year. For a small toy breed or a kitten, that's a bit younger. So there are some guidelines we all use. Yeah, about a year or so if you're a toy breed or you're a kitten, but maybe out to about 18 or 24 months if you are a large or giant breed dog. And again, great conversation, great question for your veterinarian who is familiar with your dog or cat and how they are growing. So this for me, before I turn it back and don't take too much of our other experts' time, also is going to address some of the question that we have about gaps in the diet and should I supplement and how. Well, if we are starting with a diet that is complete and balanced, meets that animal's recommended daily allowance for nutrients in whatever form it comes, whether it is commercially prepared by a company that has nutritionists and expertise to do so and do so well, or you make the decision to cook for yourself with the guidance of individuals with expertise to formulate that type of diet, we may not want to supplement in addition to that. We may, as we already talked about for certain disease conditions, decide that for that individual, supplementation with a probiotic might be beneficial, or supplementation with medium chain triglycerides or omega-3 fatty acids might be. But that's kind of getting into the weeds and the personalization of nutrition, which is a conversation that I suggest you do working with your veterinarian. So I'm going to turn it, I'll let either panelist decide who wants to weigh in on the conversation. Again, we're getting a lot of questions. I'll let it take the direction that you like. I know you hear them as well, but we're getting questions about, should I be cooking for my pet? Are there certain ingredients I should be looking for or not looking for? So let's start broad and let's just kind of see how our discussion goes.
Sure. Kurt, do you want to start or?
Well, you know what? How about this, John? I'll start really broad, right? And then you can maybe hone it. Does that sound okay?
Perfect.
Just because I'm going to keep it, I try to keep it really simple. When I'm asked, what should I be looking for in a pet food? What are my considerations, as a pet owner? I keep it pretty simple. 5 things. First, number 1, it needs to be complete and balanced. 2, it needs to be appropriate for life stage. So puppy versus adult versus geriatric. We've already talked about that a lot. Third, appropriate for lifestyle. We have a pack of Labrador retrievers here at my home, and they have different metabolisms. Some, I can't feed them the same because one is more active than the other, even though they're relatively the same age. So that's lifestyle. The fourth one is special needs I talk about that in terms of, any medical conditions your pets may have. So it could be diabetes in a cat, it could be osteoarthritis in a dog. Certainly obesity is the most common disease that we see in pets. Special needs. And then the last one is preferences. And it's preference of both the pet, what they like. They may prefer a certain protein type. They may prefer a certain texture. They may prefer wet food to dry food. And then also preference of the owner. Where do they want to actually obtain their food? Do they want to actually make that homemade food? And so those are my 5 kind of simple categorizations. And I'll turn it back to you, John.
No, I think that's a really good way to put it. And often what I do is kind of take the broad approach and kind of think about it from a nutritional standpoint versus a food value standpoint too. And I think you touched on that, but I like to separate those out sometimes for pet owners because I think there's a real difference there. And so my thought is that, you've got to think first about what those nutritional requirements are that you just mentioned, life stage and so on. And then there are those areas that really get into, I think, food values and things like that are kind of a gray area. And for example, home cooking versus not home cooking. In most cases, I would say that's probably a gray area. There are some caveats though. So many people who decide to home cook for their pets do that more because that's kind of a food value for them and they want to do that for their pet. Their pet doesn't necessarily need that nutritionally. I said there's a caveat though. There are cases where pets have whatever medical condition where there just isn't a great diet out there for them individually, or there is and they won't eat it. So there are places where it's not so much of a decision as kind of, you got to feed a home cooked diet at that point. So I think, in terms of kibble and canned food and home cooked diets, I think that there's a lot of choice there, right? I'd be very reluctant to say that one is really better than the other. I think you've got to fit it to your values and your pet. But I think one of the most important things when choosing any food is first to look if it's actually balanced, if there is a nutritional adequacy statement. And so essentially the easy way is to look somewhere on that bag and see if you can find the acronym AFCO. And if you can't find that, then sometimes you need to contact the company to find out more. But if that is kind of the benchmark for nutritional adequacy for commercial diets. Now, if you have a home cooked diet, my recommendation is that you work with someone or a company that has established the nutritional adequacy of the home cooked diet. There are different ways to do that, but nutritionist at Cornell. We have a nutrition service that balances home cooked diets. Laura, I suspect you do that too through Oradell. There are a lot of vet colleges that do that. And then I'll throw out Balance It is a company that if you have a healthy dog and want a balanced recipe for them, you can go to Balance It and they will they'll give you a recipe and they have supplements. One of the things that I often see where people run into trouble is they very well meaning and certainly, you know, the outcome could be good with a little help, is feeding a home cooked diet, but not really delving into what that means in terms of nutrients. And you know, I think there's kind of the conception sometimes that, you know, dogs need meat or cats need meat, but Laura mentioned this much earlier that, you know, for example, there's really not enough, virtually no vitamin D in just, you know, say chicken breast. And so that's not a balanced diet. And home cooked diets, you really have to be careful about. So look for some expertise there.
And I think, you know, John, you make me think about maybe 2 points that I think we'd all agree on, which is, you know, when you think about food ideologies, right? That's what we talk about, trends that are going on, people want to feed a certain way. I think it's always important to make sure that it's based in science, right? That even though and everyone's doing the best that they're trying to do the best for their pets. We know that. That's why, you know, they're part of our lives and we love them. But we want to make sure that what we're doing is grounded in science, or as you know, one of my mentors and proud Cornell alum, Dr. Stephen Ettinger would say, you know, it's based in evidence-based medicine, right? And that's so important because there's so much information out there right now. And even though people want to do the best they can, they need to make sure that whatever source they're looking at is reputable. And that's, you know, that's the power of a meeting like this today. That's the power of Cornell Veterinary School and other institutions and board certified nutritionists. And so my message to folks is you want to do what's best for your pet. So make sure that it's really grounded in science and supported by experts, because I think that's key. And then that leads to the second point that Laura mentioned, which is no one knows more about the health and well-being of your pet than your veterinarian and his or her staff. And so that's where, and veterinarians love to have these conversations and love the bonding time with their clients and certainly with the pets. And so, you know, take the time if you have questions like this to speak to your veterinarian.
Yeah.
I am loving what I'm seeing in the chat. Janet just said Dr. Ettinger was her veterinarian. Oh my goodness. Couldn't have a better veterinarian. Robert put a link in the Q&A that was fantastic. Somebody asked, you know, what is this AFCO? It's actually Association of Animal Feed Control Officials. They come up with this book that essentially contains that, you know, doggy and cat RDA. I saw there was a question about dog versus cat. Cats are carnivores. They eat animal prey. And I was trained by a nutritionist that made sure I always said that and not meat, because meat, typically for many people, we think of, as I mentioned, chicken breast or skeletal muscle, because that's what we eat. And that's not a balanced diet, but that's not what cats or dogs would eat feral anyway. And that's unfortunately where we sometimes run into trouble when people with all the best intentions in the world are trying to cook for their pets. So I echo John's sentiment. It can be done, but work with people with expertise and training in those species differences. We got a couple of questions I want to make sure we touch on, because we've spent so much time on getting pets to eat and eat you know, not eat too much. But we had a couple questions about picky eaters and tips that either John or Kurt you might have for dogs or cats that are picky.
Well, as an internist, you know, and in my nutrition work too, we encounter this a lot. And I think it's equally frustrating for us as it is for the pet owner, because a lot of times it's not an easy fix. It can be really challenging. there are kind of a few buckets that I put things into that you can do. One is drugs. And I would probably save that for last, try some other things first. It depends on what is going on with your pet, the medical condition that might be leading them to be picky. If it's a pet that is healthy and being picky, and especially a younger pet, I often recommend trying to stick it out a little bit. Because I think when you give into your pet's pickiness, it can backfire, especially, so they're picky as a young dog and you'll feed them whatever they want and they kind of get into that bad behavior. And then when they're older and then they have a medical condition that, is really impacting their appetite, boy, those are the cases that are so challenging. So I think really setting the stage that, these are your options and try to stick to them. This is another area where I think you need to talk to your veterinarian about some guidelines. But oftentimes I'll say if it's say a year-old dog that is perfectly healthy, they can go a couple days without eating, absolutely fine. And so, sometimes I've had clients that don't like this phrase, but I haven't come up with a better one. Tough love is sometimes, the best medicine. And so that's maybe one place to start. The other things that, as you start to move up the spectrum are, there are cases where you have pets that maybe have dental disease or something, there's a reason why they're picky, or they've just established that routine. And then that's where they eat. Sometimes it's the ambiance, they want to eat in a certain spot, or they don't want the cat harassing them while they eat. So looking at all of those things, sometimes it's the texture, if they have dental disease, would they do better with a soft food? So looking at it from all of those dimensions. And then finally, there are medical conditions where there are some other strategies. So for example, animals with kidney disease become very picky. And one of the things that folks have found is that preemptively rotating their food. And now there are a lot of different flavors and textures for renal diets. So say, 3 days you feed them renal diet A, the next 3 days it's renal diet B. So, giving them kind of a structured choice can be really helpful. Or, as I said before, drugs are kind of the last frontier, I guess. And there are appetite stimulants, anti-nausea medications, and those we really do try to reserve for patients that have, medical reasons why they're not eating.
And Kurt, from a pet food perspective, what type of work goes into ensuring pets will accept the food, that it's palatable? And I know we only have a couple moments, so you're just a nice little short answer.
Yeah, a tremendous amount of research. That's why we have behaviorists on staff. We have specialists in feeding behavior. We do a tremendous amount of research looking at how much do they eat of a different product, a different texture. You think about aromas, even little behavioral things. For example, if a cat is going to a particular bowl for food or water, their whisker, they do not like their whiskers hitting the side of that bowl. And so we recommend, a wider, lower bowl that doesn't, isn't off-putting to cats during that behavior. And again, all of that is based on ongoing research by experts in behavior, ethology, and things of that nature. And so all of that is infused, and that knowledge, that intellectual capital into the pet food and the innovation that you've seen today, as well as what you're going to see, hopefully, for the next few decades.
This has been incredible. And I know we could talk about this all day long, but unfortunately, it's already 1 o'clock. So first, I want to thank my good colleagues, Dr. Loftus, Dr. Venator, for your sharing your knowledge, your expertise. I absolutely want to thank our audience. Again, so many questions. We need to come back and do this again. In lieu of that, I do want to encourage each of you to speak with your veterinarian. Remember, you know your pet best. Your veterinarian has the scientific training and the years of experience to know what types of foods and strategies would probably work best for your pet. And I also absolutely want to thank my alma mater, Cornell University, and this incredible team who put this program together today. I hope it highlighted just how much nutrition knowledge we have right in our institution for dogs and cats, and how that translates into this concept of one health for all of that. So with that, everybody, thank you for your attention. Stay well, and I hope to see you again.
Thank you.
Thank you.